Hi, Michael Bloom, chiropractor. Let's talk about recovery times. Lower back pain is one of the most common back ailments that bother people worldwide. And so often when people come to see me, they're interested in how long is it going to be until I start to feel better? And it's an interesting question. It's quite complicated to answer, but I'll do my best to simplify it right now. So first of all, we need to figure out what's the source of the back pain. Now, broadly speaking, there's two main sources. One source is that you've actually got something systemically wrong with you, which is affecting the lower back. And that might be a disease process, that might be an infection, that could be something quite critically important to get on top of, often with the assistance of the medical fraternity. The vast majority, however, of back pain is what's termed mechanical back pain. And mechanical back pain, as the name sounds, it's of a mechanical origin. So the origin is about or due to the fact that the mechanics or the movement of the spine and the alignment of the spine isn't doing what it should be. And that can start to evoke changes within the localized region of the spine. That can affect the nerves, that it can affect the discs, the ligaments, the tendons, and that ultimately can lead to lower back pain. So with reference to mechanical lower back pain, how long will it take to feel better? Well, broadly speaking, then if we segregate mechanical pain into an acute injury versus a chronic buildup, then the acute injury is something that's just happened recently. You may have literally tripped over or been in a sporting incident or been in a motor vehicle accident and there's been a sudden trauma. Now, usually in those scenarios, there's an intense onset of pain, and that intense onset of pain may last for days into a week or two, and then gradually that will subside. But acute pain of the lower back, even that's not as common as the chronic buildup, and that's what I want to speak to you about. The chronic buildup is when you start to recognize you've got back pain, you don't exactly know why, and there's a reason you don't know why, because there is no one reason. It's a slow build-up over time, often posture-based, often lifestyle-based. And here's the thing, when you're talking about recovery, what are you talking about? Are you talking about just feeling better, or are you talking about structurally recovering? So if we're talking about just feeling better, I've got good news for you. Usually, when you are aware of the chronic buildup and you put yourself into the care of someone that knows what they're doing, then that person can usually assist you with their skills, their hands-on skills, their advice, etc. They can help you, and you can often start to feel better in a matter of somewhere between 2 to 6 weeks. And bear in mind, that's pretty good, because usually the background as to how you got there in the first place may have taken months or years. That's when you will start to feel better quite commonly. But when are you actually going to structurally be sound? When is the system going to be reliable? When are you going to be able to get back to doing the things within your life that you want to do without fearing you're just a little misstep away from being back at square one? That can take months. Now, how do we know how long that's going to take? That is really a matter of the clinician being skilled in being able to assess some key factors within you to start with. First of all, a really good case history, so an understanding of you and your background, health background. Secondly, it's a really important to do a good physical examination, especially measuring range of movement, especially measuring posture, and in chronic cases, very commonly getting structural x-rays to have a look at how the bone architecture and structure is. Then if you factor in your lifestyle, so for example, if you sit down all day and do minimal exercise versus someone who's mobile regularly and does regular exercise, yet all the physical testing was more or less equal, their healing time to get back to a strong, resilient version of yourself will be faster for the active person than for the sedentary person. But broadly speaking, A chronic problem which can take months to years to develop before you may even be aware of it will take often months to actually heal to the point where you've got reliability, you've got strength, and you can get back to the daily activities and even things that you may have written off that you could never do, you can get back to doing again. But the good news to finish on again and to reiterate is that the pain levels can start to subside if you're in the hands of a skilled practitioner within a matter of a few weeks. So pain is one thing, and actually structural integrity and structural function is another thing. They've got different time frames. And depending on your philosophy of health and the amount of effort that you want to put into it, and also your interest in how you want to be in a decade from now, that comes down to whether you follow through a care plan that's going to really get you a great deep result versus one that's just really scraping the surface and dealing with the symptoms only. I hope this has been of benefit to you, and if you have any questions, please type them below and I'll be doing my best to get back to you with some feedback. Thanks for watching.